much for having me. So this session is designed to hopefully cut through some of the noise, because in the cancer space there is a lot of noise when it comes to cancer and diet. So we're going to look at what the science actually says about nutrition and how it can support your health during or after cancer. And I'm also going to talk about gut health, because gut health is pretty important, especially when we're thinking about some of the cancer therapies that are out there. I know there's a session on the gut microbiome, so I'm not going to go into it too much, but it is important to mention. So just to introduce me, so I'm a registered dietitian, and it's just worth noting that there are differences in nutrition professionals. Dietitians are the only regulated healthcare professionals in the nutrition space. There are some amazing nutritional therapists and nutritionists out there, but they are not regulated. Anyone can call themselves a nutritionist, and they may have almost no qualifications. So it's just worth making you aware that there's lots of noise in the nutrition professional space as well. I also do a lot of work with the cancer care platform Percy Health, and I've had some research published in the space of breast cancer survivorship as well. So when I first tell people that I'm a dietitian, whether it's in the professional or the friend space, a lot of people think that I'm going to judge their diet, and I just want to let you know that that is not what I'm about. And there is a lot of noise, like I've said, in sort of the world of diet at the moment. There's a lot of, this is good, this is bad, this is healthy, this is not unhealthy. And often this black or white thinking can lead to guilt, it can lead to confusion, it can lead to fear, rather than actually just making some decent choices. And like I said, after a cancer diagnosis, this decision-making can become even harder because suddenly there's helpful articles that people are sending you. You might have seen social media posts talking about which food does this or which food doesn't do this or which supplement you might want to take. And that fear then can overshadow the science and actually lead to kind of restrictive eating behaviours, which we don't want. So today is all about clearing that confusion up. And first of all, the thing that I normally get asked about the most is, what foods should I avoid? That's the first thing that everyone wants to know. What do I need to cut out? And often cutting out isn't what I'm going to recommend, but I'll just take you through the two things, well, there's actually a third, but the two things that people should ideally be avoiding when we're thinking about cancer and diet. And the first is processed meats. So not directly linked to ocular melanoma, but processed meats are cancer-forming foods. So I'm not going to sugarcoat it, that's what they are. Processed meats like ham, bacon, hot dogs, some deli meats, and even gammon, they are cancer-forming in three different ways. They're a red meat. High intakes of red meat isn't ideal, but red meat actually is okay. But with processed meats, they are also cooked at very high temperatures, and they have nitrites, some chemicals added to them to preserve them. This combination of high heat with the nitrites in the red meat means that they form cancer-forming compounds when they go in our body. So ideally, according to the World Cancer Research Fund, we should be avoiding processed meats for our health. That being said, if we were to avoid processed meats from our diet, it would reduce our colorectal cancer risk by about 10%, but putting things into the diet can reduce our cancer risk by about 50%. So there's a lot of things that we can do by adding in. So I don't want you to get too bogged down by the taking things out part. It's also just worth mentioning that nitrite-free bacon actually technically isn't nitrite-free. It's a marketing kind of myth. They use concentrated celery juice, which has the same effect in the body. So ideally, just go nitrite-free. You can get things like Serrano ham, prosciutto, that are dry-cured, and they just have salt, and they don't have nitrites. Those ones are the ones that I would go for. Alcohol is the only other thing that I would recommend to avoid, because again, there's no sugarcoating it. Alcohol, even in the tiniest amount, causes damage into the body when we have it. And the World Cancer Research Fund recommends that for our health, everyone abstains from alcohol. Now, alcohol is linked to multiple different types of cancers, including breast cancer, colorectal cancer, upper GI cancers, and really, it doesn't just cause cancer, it also can cause the lining of the gut to become more leaky. So when you have a leaky gut, you're more likely to have digestive symptoms. And if you're going through cancer treatment, we don't want to exacerbate any digestive symptoms that you may be having. So for our health, ideally, we should be avoiding alcohol. The third thing to potentially avoid is grapefruit, not because it's going to do anything in terms of cancer risk, but because it can interfere with a heck of a lot of different medications. Now, not everybody will need to avoid grapefruit. My recommendation is that you talk to your oncology team about whether you're on any type of medications that grapefruit will interfere with, because it can ultimately mean drugs are kept in the body for too long or drugs are passed out of the body too quickly, and we don't want that to happen. So, next up, I'm just going to run through some of the most commonly asked questions that I see in clinic when it comes to cancer and diet. And the first one that comes up is always sugar. Now, has anybody, just a show of hands, has anyone read that sugar is bad when it comes to cancer? There's quite a lot of hands going up straight away. So now we've got to think about sugar, because yes, we've got obviously sugary foods like cakes and sweets and biscuits, things where we've added sugar to them to make them taste good. And that obviously isn't super duper nutritious. But when we're thinking about cancer specifically, these foods are not going to cause cancer. They're not going to make cancer grow any faster. All food, whether it's protein, fats, carbs, sugar, will go to all the cells in the body, whether that is a cancer cell or a healthy cell. Cancer cells need energy, just like our healthy cells need energy. And we cannot say to the food that we're eating, please only go to the healthy cells. What we want to be thinking about is diet quality and supporting our healthy cells as much as we possibly can. And it doesn't take rocket science. You don't need to be a dietitian to realise that a diet high in added sugar foods and low in natural whole foods is probably not going to be the best for us. We want to be thinking about having sugar from our foods that also contain fibre, vitamins, minerals. Those are the foods that are going to really nourish and support you. If you want to have cakes, sweets and biscuits, you absolutely can do. It's not going to do anything in terms of cancer growth. It will provide you probably with some enjoyment, and that is a really important part of nutrition. So hopefully that will relax some fear around sugar. But the one thing I would say is if you're having loads of sugar, high sugar foods, we may want to start transitioning away from some, because a diet high in added sugars is a little bit more inflammatory, and in the world of cancer nutrition, we want to be thinking more anti-inflammatory to support the body. So just following on to that as well then, ketogenic diet is something that comes up in the cancer space, and the ketogenic diet is something that was developed in the 1920s to support people with epilepsy where seizures are uncontrolled. And we actually use it in the brain cancer space as well when someone's having uncontrolled seizures. The ketogenic diet looks to remove pretty much all sugar from the diet and replace it with fat, so that your metabolism, actually your body actually is using fat instead of sugar. Do we need to be doing this? No, we don't, because actually the evidence tells us that the foods that you'd be taking out on this diet, all of your plant foods, they're really good for you. They contain lots of vitamins and minerals and fibre. But there is some interesting research in the cancer space around the ketogenic diet. It's just in test tubes and in like animal studies, and we are not animals or test tubes. So there's no strong evidence that we need to be following a ketogenic diet. If you were thinking about doing it, it's just worth mentioning that there are multiple different negative side effects, things like headaches, constipation, nutritional deficiencies, fatigue. You may have an increased risk of developing kidney stones and having unhealthy fats levels rise in your blood, as well as losing food enjoyment because it's incredibly restrictive and difficult to follow and implement, especially if you live with others and are cooking. So the ketogenic diet gets a no for me. Sometimes in the weight loss space, ketogenic diet comes up as well, and that's completely different. It's just trendy, the keto diet. That just means low carbs. And actually, if we're thinking about carbs, which I'll mention in a mo, whole grain carbohydrates are incredibly good for us. So the ketogenic diet, which takes those out, again, gets a thumbs down from me. Another diet that is trending at the moment is the carnivore diet. This is a diet where you take out, again, all of your plant foods and you eat predominantly animal foods. So it's high in protein and animal fats. And you know what? Some people report that they feel better with their digestion on this, and there's a lot of misinformation in this space. But ultimately, if you were following a carnivore diet, you will be putting yourself at risk for severe nutritional deficiencies. You will be having increased inflammation in the lining of your gut, increasing your risk of colorectal cancer. So you may feel better in the short term, but there may be hidden dangers that are growing behind the scenes. So the carnivore diet gets a no for me. On the other end of the spectrum, should we all be going vegan? The answer is no, according to the evidence. We don't need to be completely vegan, which is where you don't have any animal products, you're just having a plant-only diet. We have incredible evidence that a plant-rich diet is brilliant for us. It nourishes our gut microbiome, which is a key part of supporting our health, but we don't have to be vegan in order to achieve those benefits. And actually, when we're thinking about cancer nutrition, protein requirements is something that I would talk to somebody about if they were following a vegan diet, because when you are living with cancer, your protein requirements are actually higher. That is because protein helps your body to repair and build muscle. And if for anyone that's having surgery or if they're on any active cancer treatment, it's really important that we're getting enough protein, not only just to support your muscles and your immune system, but for wound healing as well. And protein requirements can be double when you have cancer in your body. So as someone who weighs 60 kilograms, my protein requirements without cancer are around 60 grams of protein, which could be roughly a chicken breast in a day. If I was living with cancer in my body, my protein requirements could be double, so 120 grams of protein. Now that may not be too tricky for me to get in this size body. If I was living in a much larger body, it suddenly becomes a lot higher requirement that you might have to have. And so for anyone who is following a vegan diet, you can see just in this image here, like that's a small plate of lentils, it's only 11 grams of protein. You suddenly would have to be thinking about pairing your protein sources and making sure that you're getting enough overall across the day. And it may be that we need a protein supplement to support you as well. So whilst we don't need to be vegan, if someone wants to be, because of course there's ethical and environmental reasons, you absolutely can be, but I recommend that you do work with a dietitian, and the Vegan Society's got some brilliant resources. If anyone's looking, they've got a brilliant diagram about how to get a decent amount of protein across the day. So another question that comes up a lot is, should we be eating organic? Now, when we're thinking about the evidence, there is no conclusive evidence that eating organic will reduce our cancer risk. They've done long-term population studies in multiple different places across the world, and actually what we know about organic pesticides is much less versus what we know about inorganic pesticides. So when we're thinking about organic versus non-organic, I mean, there are some organic companies like Riverford or Abel & Cole, they actually claim that they try not to use pesticides. So if I was going to go organic, I probably would want to sort of look into that space. But ultimately, you don't have to eat organic. It's often more expensive. There isn't evidence that it's beneficial in terms of nutrition or cancer risk. The most practical advice I could say is to, if you're not going to be peeling things, wash your food before you eat it, whether it's organic or non-organic, because even the organic may have some pesticides on. So the next slide is trending at the moment, ultra-processed foods. Has anyone seen the Joe Wicks Killer Bar recently? A few people might have done. So ultra-processed foods is hot in the press at the moment, and there's lots of campaigns going around about trying to reduce the amount of ultra-processed foods that we have in our diet. So what are ultra-processed foods to begin with? They are food products that have gone through multiple stages of industrial processing, and they often contain ingredients that we wouldn't usually use at home, things like emulsifiers, additives, preservatives. Now, these types of additives and preservatives and emulsifiers, whilst they aren't thought to directly cause cancer, we know that diets high in these foods are associated with poorer diet quality and probably increased obesity, and we know that obesity is a risk factor for many different types of cancers. The classification system for ultra-processed foods is massively flawed. I just wanted to explain it to you because you've got corn, for example. If you were to buy a corn on the cob and it still might have some of the leaves on it, that is not a processed food. If you then remove the corn, the kernels from the cob and put it into a bag in the freezer, that becomes minimally processed. But then if you take that sweet corn, you grind it up, you add some flavours and preservatives to keep it shelf stable, and you turn it into corn chips, that becomes an ultra-processed food. Now, some foods are obvious which ones are going to be good for us and which ones might not be. Looking at the packet is always, and the ingredients list is always a good place to start. But hummus, for example, is classified as an ultra-processed food. But hummus is nutritious for us. It's a good source of fibre, it's a plant food, it's brilliant. So we do have to have an element of critical thinking when we're looking. There are some hummuses that have got loads of added ingredients and some hummuses that will go off faster that don't have. So when you're making some food choices, maybe just start to have a look at what's in the ingredients list. We don't have to avoid, some people are saying if it's got loads of ingredients that you can't pronounce, it must be bad for us. Well, sometimes they're just vitamins and minerals that they've added and they're just giving the full name. So I don't like that logic. But if you're seeing that there are E numbers and preservatives and additives, we want to just try to minimize the amount that we're having. And then the alkaline diet is another one that comes up quite often, but probably trending a little bit less, which I'm quite happy about. The alkaline diet is based on the idea that certain foods can change the pH of your body, which will make it more alkaline, which cancer cells don't really like. It sounds quite appealing in theory, but the actual science is that your body very tightly regulates your pH. We might be able to change the pH of our wee, and that's just reflective of the food that we're eating, but if your pH of your blood was too acid or too alkaline, you'd be in hospital, probably on life support. So we don't need to worry about the pH of our food. The alkaline diet in itself has principles that I'm on board with because it's including lots of different types of plants and fibre. So that's the only sort of saving grace of it. But if you've got an alkaline diet book, you can look at the food part, but just don't look at anything else it says in there. I get asked a lot about supplements, and if we've got time, I might be able to answer some questions about supplements. Ultimately, if you're on any type of cancer treatment, you need to make sure that supplements are safe because supplements, especially things like vitamins and herbs, natural doesn't mean safe. It can interfere with lots of different types of medications, which obviously we don't want to have. The key things to avoid if you're on active cancer treatment are high-dose antioxidants. So things that we know that are quite supportive for your immune system, like vitamin C to help fight off colds and things. Vitamin C, vitamin A, zinc, vitamin E, they're very high-dose antioxidants. And the theory is that they may actually protect the cancer cells that the cancer treatment's trying to target. And we obviously don't want that. We want to keep the cancer cells vulnerable whilst you're on cancer treatment. Antioxidants through food, so food sources of zinc, vitamin A, vitamin C, vitamin E, they are fine. When you concentrate something into a supplement form, that's where the risk can arise. There is, and also probiotics. So I mentioned that gut health is quite important, and I know that there's going to be a session later talking about oncobiotics, which is going to be really interesting. I just wanted to highlight that there is a caution for anyone who's on cancer treatment with probiotics because your gut lining is naturally a little bit leaky. If your white blood cells drop at any time, which can happen on any type of cancer treatment, you're more susceptible to picking up infections. If you add live bacteria from a probiotic in there, there is a risk you may get what's called neutropenic sepsis, which we obviously don't want. It can be very, very dangerous, potentially fatal. So caution with probiotics if you're on active treatment. If you're not on treatment, a probiotic may be helpful, but there is no evidence to suggest that the general population needs to take one to support their health. Actually, feeding the microbes in our gut through the foods that we're eating is much better most of the time. But there are certain probiotics that can be really helpful for certain conditions. So if someone is experiencing, colitis or IBS, irritable bowel syndrome, constipation, diarrhea, there are certain strains of probiotics that I would match to the symptoms that you're having. A general Holland and Barrett supplement's probably not been tested in any way, shape or form. We want to have one that's been tested in clinical studies to show it can reach the gut alive and treat what we want it to treat. So we want to be selective with the products that we're choosing. And as mentioned, food sources are always probably going to be the best. If you did want to take a supplement of something, like a multivitamin, when you're looking at the back of the packet, look for something that's got no more than 100% of the RDA, the recommended daily amount. Most supplements, a lot of them will have like 200, 300, some of them 2,000% of what you actually might need in a day. And again, that we don't want that for anyone who's on active treatment. Something like Boots or Superdrug do like an A to Z general multivitamin that contains 100% and not more than that. If you've got nutritional deficiencies, you absolutely may need to have a supplement, but they should be guided ideally with your oncology team and an oncology dietitian. There is one supplement I want everybody to have. Can I just have a show of hands if anyone's taking vitamin D at the moment? Yes, this is brilliant. There's some hands that aren't up though, so this is important. I mean, it's important that all of you listen, but this is important for you if your hand didn't go up. Vitamin D is something that we cannot get this time of year from sunlight. So our body will synthesize, it will make vitamin D from UV. And this time of year, October to April sort of time, we just can't make enough. And it's not possible to get enough through our food. Vitamin D is incredibly important for your immune system. So low levels of vitamin D can lead to things like increased infections, coughs and colds and flus and things like that. So we need to optimize your vitamin D. And actually, I'm going to diss the NHS very slightly here because the NHS healthy range of vitamin D may not actually be your optimal range of vitamin D. So you may get your test result back and it may say that it's adequate. I don't want your range to be adequate, I want it to be optimal. The optimal range is 75 to 100 nanomoles per litre. And we don't want to be too high over that either because too much vitamin D in the body can cause serious side effects. So we want to just make sure that we're maintaining in this range. My recommendation is that everybody should get their levels tested around this time of year to guide how much vitamin D that you need to take. I know that my body doesn't really store vitamin D very well. I need to take a slightly higher dose than the government recommendation. The government recommendation is, oh, that's gone a bit funny on there, is 400 units, international units per day. Again, that isn't enough for a lot of people to prevent deficiency. My recommendation is to take 1,000 international units per day as a maintenance dose once you know you're in that optimal range. If you're not in that optimal range, it's very likely that you will need to have a higher dose, perhaps for a couple of months, to bring you back up, and then we go to 1,000 units to keep you stable. And ideally, we want to test each year to know that we are in that range. And you can get these tests for sort of £30, or you can ask your GP or oncology team, and they will be able to sort it for you. For anyone that is interested in supplements, because I do get lots of questions on supplements, this would be a credible resource that I would probably signpost you to, but I don't want you to rush to go and look at there specifically if you don't have questions about supplements. Memorial Sloan Kettering Cancer Society is in America. This is an evidence-based resource. They have got a resource called About Herbs. They've got a mobile app that you can download as well, which is quite handy, and you can search for any type of supplement on there. So on here, I've searched for turmeric, for example, something that I get asked about quite a lot. And you can see here, there's I've highlighted here in red that they've got a section for herb-drug interactions. Now, you can see with turmeric here, this is the list of herb-drug interactions. And I mean, I don't know what a CYP344 enzyme is. That's the job of an oncology pharmacist to know whether that's something that is of concern for you. But this might give you a little bit of a steer of whether something is necessary or safe. It will also have the evidence of, actually, is there any evidence that this will even be helpful? So I just want to then talk about what to focus on, and then I'm going to come to some questions, because what to focus on is far more important on what we should be thinking about taking out, because I mentioned earlier that we can reduce our cancer risk by excluding alcohol, excluding processed meats. Increasing fibre intake can reduce your colorectal cancer risk by 30%. That is a massive amount. And when we're thinking about the global evidence for cancer and nutrition, the Mediterranean-style diet and similar kind of dietary patterns tends to come out on top overall, time and time again. So what's included in this type of dietary pattern? We've got things, the plant foods, so we've got fibre. Fibre is incredibly important, and I'll come back to it again in a moment. Omega-3 rich foods, so things like oily fish, walnuts, chia seeds, flax seeds. Omega-3 rich foods are very anti-inflammatory. And inflammation is something that we want to be thinking about reducing, because a lot of cancer treatment can be quite pro-inflammatory. And we can test our omega-3 levels. It's not something generally that's done in the NHS. It's more sort of like a personalised nutrition thing. But if you don't have omega-3 rich foods in your diet, it might be worth thinking about whether you can get some in. So oily fish, I quite like the acronym SMASH: salmon, mackerel, anchovies, sardines and herring. It took me a minute there, I had to think about that. And experiment with different types. There's lots of different types of sardines and anchovies and mackerel out there. You may want to, smoked is totally as okay as well, by the way. But if you don't have much of these in your diet, you may benefit from a supplement if it's not going to interfere with anything that you're taking. So that's one to think about. Extra virgin olive oil is incredibly anti-inflammatory. It has the same type of anti-inflammatory action in the body as ibuprofen, and they have done studies on things like fibromyalgia, like a chronic pain condition, and they found that 4 tablespoons of olive oil per day significantly reduced people's pain symptoms over 3 months, which is quite incredible considering it's just some olive oil. It's worth mentioning that olive oil is a source of fat. Fat is calories, and if you're starting to drink extra fat, it's just something to be aware of if weight management is something that's important to you. And then the other core element of the Mediterranean-style diet is that they don't have much in the way of ultra-processed foods. So again, we want to keep that to a minimum. Now, I'm just going to whiz through how to optimize your gut health, because taking the time to understand and look after our gut microbiome is one of the single best ways that we can invest in our health. And there's some incredible research that's happening at the moment in the world of the gut microbiome. So we know that our gut can influence our inflammation levels in our body. We know that supporting the gut microbiome may actually have an impact on how effective treatments are, like some immunotherapy treatments. It may reduce treatment side effects if we can support our gut health, and it may impact treatment outcomes. Very early days in research, but very exciting for me. So I'm going to introduce you a little bit to the gut microbiome and how we can support it. Here's a bit of a CV for you of the things that we have scientific evidence that the gut microbiome can help with. So we've got things like supporting our mental health. We know that supporting the gut microbiome can reduce depression scores. There's been huge studies on that. It's been linked with weight management, skin health, hormone health, fatigue, sleep, long COVID, and importantly, our immune health. 70% of your immune system cells are in the lining of your gut. So if we support your gut, we will be supporting your immune system. So how do we support our gut then? Has anyone heard of the 30 plants per week concept? A few people have. Don't worry if you haven't. We used to know that there was, have your fruit and veg 5 a day. That 5 a day target came out of nowhere, because that's often what happens in the government. Ultimately, it was a target that felt achievable, the number 5, but that focuses on our fruits and our vegetables only. And when we're thinking about plant foods in our diet, yes, we've got fruits and vegetables, but we also have other types of plants. And when I do like a sort of a food history with somebody, Often it's the other types of plants that we want to work on adding in. So things like your whole grains. When we have whole grains, it actually helps to reduce inflammation in the lining of the gut. So that's, and I'll come on to this in a sec. We've got legumes, we've got nuts and seeds, and to a lesser extent, herbs and spices. They are plants, and they're loaded with what's called polyphenols, these plant-based chemicals that are very supportive for our immune system. So how can we make some very simple changes to support our gut health? I like to start with breakfast, and can I just have a show of hands, or maybe someone can shout out us a breakfast that they like to have? Well, you said porridge, that's what I'm going to start with, so thank you. This was not planned. A porridge, if you're having quick cook instant oats, we don't count that as a plant because it has been sort of processed so much that the fiber's almost whizzed up and away. But if you have the whole oat, the jumbo oat, that is a plant. So a porridge, in a plain porridge, you're having a plant. Let's think about how we can add to that. We can add things like chia seeds, flax seeds, hemp seeds, different types of berries and other types of fruits, and we can add nuts and seeds. You don't have to add all of these things whole. What I quite like to do is I take a blender and I'll take a handful of each different type of nut that I might have. I might put some pumpkin seeds and some sunflower seeds in there, whiz it up to make like a nut and seed sprinkle. You can then bake your oats with maybe some maple syrup and some olive oil, and that is essentially a granola. You could soak it overnight. You could call it overnight oats. There's a lot of things that we can do with oats and this combination. Ultimately, when I have my breakfast in the morning, I'm not just having one plant from my oat. I'm probably having about 13 plants to start my day. They may very well be the same 13 plants to start my day every morning. So when we're counting towards that 30, we don't repeat them. We just count them the once in a week. But it's a brilliant start for the day to support the gut microbiome. And then we want to think about making some very simple swaps. So a lot of us, we're creatures of habit. When we do our shopping list, we're buying the same things over and over again. That's just who we are. But we want to take a look at the other options that are out there, because there's lots of different types of breads. If you're buying white bread, white pasta, white rice, it's not feeding your gut microbes, I'm afraid. So we want to be thinking about the whole grain options. And there's lots of variety. I've got some quinoa here. If you've never had quinoa, that's going to feed your gut microbes, and you can mix it in with rice. Maybe think about looking at what is on the shelves that's different to what you might normally buy. Hot in our kitchen at the moment is the sort of like the mixed wild rice mix. My daughter's absolutely loving that at the moment. And there's loads of different types of pastas available. Just ditch the white pasta because it's not going to do anything for you. We want to get the whole grain option. There's some whole grain options taste nicer than others. Some of the supermarket whole grain options are very low in fibre though. So when you're just choosing, look at the fibre content, go for the one that's got the highest amount. And then frozen is amazing because in terms of both nutrition as well as if you're fatigued, because cancer treatment can leave you feeling quite fatigued. And a lot of us will have peas and sweet corn in a freezer, but you can also get things like Mediterranean veg mixes. You can get stir-fry mixes, edamame beans. Have a look to see what's in the freezer aisle and stock up for adding things. If I was going to have scrambled eggs on toast for breakfast, it wouldn't just be scrambled eggs. I'd have some frozen peppers. I might have some edamame beans. I might have a mushroom. It doesn't have to be a lot, just maybe one mushroom, a couple of these things, but we want to be thinking about that variety, and frozen makes it convenient. Worth just mentioning juicing. I'm not a big fan of juicing because it takes out the fibre, but if you were to blend where you're keeping all the fibre in, that is going to be a slightly better option for you. And if for someone who doesn't really like to have fruit, having like a frozen smoothie can actually be quite nutritious. Just drink it slowly because we don't want to down a whole load of sugar all at once. And then we've also got legumes, so the thing that people miss out the most. Now, there's nothing wrong with beans on toast. It's actually a pretty nutritious dish, but beans on toast, if you've got whole grain bread, is 2 plants. A lot of supermarkets do 5-bean baked beans. Very simple swap. You've suddenly got 5 plants instead of 1. So that's a good option. You don't have to buy dried. If you want to buy dried, you need to soak them overnight. tinned will be much easier way to start. And if you've got a sensitive gut, if you've got any bloating or wind or anything like that, buying the tinned will be easier to digest. Rinse them really well because you'll be throwing away some of the sugars that are very highly fermentable that can trigger that gas. And then if you are gassy, just keep the portion sizes small to give your gut a chance to get used to it. And then don't forget that things like hummus can be brilliant for you. Some of the hummuses have got things like chickpeas and pine nuts in, so I would always choose those ones if I could as well. So just to round up then, here's a checklist for looking after our gut microbiome. We want to aim for diversity, and diversity across your day, diversity across your week. We also want to be cautious about how much fluid we're drinking, because fibre needs fluid in order to move through your gastrointestinal tract. And if you don't have enough of fluid, you're probably going to experience gastrointestinal symptoms, which we obviously don't want, and that can put people off from eating. But we also need to increase our fibre intake gradually. If you go today from having a plain porridge to tomorrow having 13 plants in your breakfast, you may shock your gut a little bit, and so we need to make some changes gradually. And then we want to make it tasty. Add things like herbs and spices, because if you're making it tasty, you're more likely to do it again. Putting this all together looks like focusing on inclusion, not restriction. And this, I don't like the UK Eat Well plate, which you may have seen on the NHS website. This is the Canadian Eat Well guide, and I think it's a much prettier version of the same sort of thing. Essentially, this is the proportions that we want to be thinking about eating, whether it's in a day or whether it's in a week or whether it's in a year. About half of our diet should come from colourful plant foods, thinking about that kind of rainbow and thinking about making it different as much as possible throughout the week. It's better to have 5 mouthfuls of different things than 5 mouthfuls of one thing. So less meat and 2 veg and more meat and 5 veg. And then whole grains and proteins. We want to just be making sure that we have got the right sort of balance here. So that's it for me. I'm happy to take some questions. It was just to let you know that I also support people through a range of gastrointestinal symptoms as well. So a lot of patients will have gastrointestinal conditions before they start cancer treatment. They may develop them during cancer treatment. So that's something that I support in my clinic. And if anyone wants to ask me any questions, I'm more than happy to hang around at lunchtime as well. That's it.